Now we'll look at the abdominal organs here. These are the small intestines. The small intestines are attached by the mesentery, which is this nice membrane that is near the intestine and attaching it to the wall of the pig. See the membrane there? Now in the membrane there are these pink lines. Those are the what? Mesenteric arteries. Okay, and there should be veins there also, but you see the pink lines. Can you see that over there, Jessica? Pink lines here. Okay, those are mesenteric arteries. The mesentery is the membrane attached to the small intestine. This is the ileum and jejunum. You can't really tell what's what. Okay, with this, you can tell, however, if you look at the stomach. Here's the stomach here. Okay, this bag is the stomach. See, it has some air in it there. That's the stomach. Now, if you go beyond the stomach, there is a firm area called the pyloric sphincter, which I'm pinching right there, this pyloric sphincter. The next part of the intestine that is adjacent to the pyloric sphincter is the duodenum. So you know that's the duodenum. It's right by the pyloric sphincter. Pyloric sphincter is here, duodenum is here. Okay, the stomach is here. The leech-like spleen, or it looks like a pea pod or a leech, is right here, adjacent to the stomach. See that there? Can you see that, everybody? Okay. Also, we have the large intestine, which has a kind of worm-like look. That's this right here. It looks like a worm. See this like a kind of a cluster of worm. Okay. And when you look at the large intestine, there's also a blind pouch that attaches to the large intestine. And so you have to kind of look around for the blind pouch. On this one, it looks like it's in this area up here. And this is called the cecum. The blind pouch, it's the cecum. Okay, so it's a blind pouch from the large intestine. Cecum, C-E-C-U-M. Okay, now we move on. We look at the intestines. We have the rectum is down here. Now adjacent to the rectum, if you have the some pointer, we have the aorta. Aorta is very firm, and it's a very firm kind of white structure here. If you touch it, it's very strong. It's got more muscle in it. Okay. Next to it, we have the blue inferior vena cava. Inferior vena cava, which is right next to it. Do you see that there? Jessica, do you want to wrap around the other side if it would help you?
You can stand here, Jessica.
Okay, this is it. Inferior vena cava. This is the abdominal aorta. This is the rectum. So I said rave. Rectum, aorta, vena cava. Rectum, aorta, vena cava in that order. Okay, across. Now we have the kidneys here. Remember, the kidneys are retroperitoneal, behind the membrane. The pink structure going to the kidney is the renal artery. Okay, renal artery is a pink line going from the aorta to the kidney. Okay. Now the kidney also has a kind of a squiggly tube coming down, and from there, this squiggly tube is right here. This is the ureter. U-R-E-T-E-R. Ureter. There it is. Okay. The renal vein is a blue line which comes from the side of the kidney. So if you look at the kidney, look for a blue line. When you move the membrane away, there's a blue line that connects to the inferior vena cava. This blue line is going to attach to the inferior vena cava from the kidney. That's the renal vein. Renal vein. Okay, so you got renal artery attaching to the aorta, renal vein, which attaches to the inferior vena cava. Okay, the blue tubular structure. Okay. Down here we have the bladder in the center, which is a bag. We have the umbilical arteries on either side of the bladder, umbilical arteries. There's the bladder in the middle. Now this pig is male, so here we have the reproductive structures. We have the end of the reproductive structures, we have what's called the epididymis, which I'm pointing to. That's a white, soft area. It looks like, almost like cotton, a wet piece of cotton. Then we have the testis, which is an oval-shaped thing, which I'm pushing forward with my fingers. That is the testis. Okay, there's also a small bump, which is between the testis and the epididymis, which is called the gubernaculum. It's a little bump in this area, gubernaculum. Okay. Now, this testis has the epididymis, which we just mentioned, the epididymis, attached to the vas deferens, or ductus deferens, which is the tube that comes from the epididymis to the urethra. Okay, we have also in the area, we have this whole